City Council meeting, I thought it would be interesting that, particularly for the public to be aware, there are 9 measures that will come up for final approval that last week all received unanimous support at committee. So I'm hoping for a similar result this evening. It should be noted that most of these are either low cost or no cost initiatives, but the key here is that we hope will support London's most vulnerable. Things like deferring rent payments for 6 days for city-owned properties, expanding a discounted high-speed internet program to tenants at social and public housing units, and an extra $325,000 for the Housing Stability Bank to help cover rent and utility arrears. That's not a small amount, but it's certainly important for our most vulnerable. These measures, by the way, are in addition to actions already taken by Council, which include 60-day deferrals for each of the remaining 2020 property tax installments, by the way, with no penalties or interest, and an ongoing advocacy effort to senior levels of government as part of our economic and social impact and recovery task forces. As we've said time and again, no municipality can do it alone, and now more than ever, that's so critical. I also have some really, really positive news. I wanted to remind people about a partnership that we have that involves the London Food Bank and RBC Place, as well as support from Youth Opportunities Unlimited. This particular initiative kicks off tomorrow. So here's the interesting thing. With the help of some chefs from RBC Place and a few dozen volunteers, Glenn Pearson and the London Food Bank will be offering nearly 200 bagged lunches each day, 7 days a week, for those in need during the pandemic. Now, these lunches will be prepared by the chefs at RBC Place, while the food bank is covering the costs of supplies. And with that, they will pick up and deliver lunches to agencies who need them. Meanwhile, Cargill, a great corporate citizen, has donated $60,000 to the London Food Bank to pay for the ingredient costs used in these bagged lunches. That includes support for those lunches coming out of Youth Opportunities Unlimited. Now, this was a gap for the identified as part of the Mayor's Social Impact and Recovery Task Force, and I'm so proud to see it all come together. Now, each bagged lunch costs somewhere between $5 and $6 to make, and while we have that tremendous support from Cargill, we also are looking for and welcoming donations to the food bank to help cover the costs. You can visit their website at londonfoodbank.ca if you have the means and the interest in supporting them. But I want to say bravo to the food bank, bravo to RBC Place, bravo to Cargill, and bravo to YOU for their great initiative to help our frontline agencies to support our most vulnerable. Over to you, Dr. Mackie.
Sure thing. Thanks, Mr. Mayor. So we had a pretty encouraging report come in yesterday. Only 1 new case of coronavirus diagnosed in Middlesex and London in the past 24 hours. Unfortunately, we did have 2 deaths. The provincial numbers are also down in the 370s for the last 2 days, and 64 deaths provincially. So again, we're seeing that trend towards lower and lower case counts, but not yet peaking from the perspective of the death count. Those are the numbers locally. I also want to speak to some comments that the Premier made today about the work that's happening to test all staff and residents in long-term care facilities across Ontario. This is something that public health units were asked to take on about 2 weeks ago, and we're working very hard with the labs to make sure that there are swabs available to test the 80,000 or so residents of long-term care across the province, and that there's lab capacity to do that testing as well. The Premier was reflecting on the data that is available at the provincial level, which actually shows that many health units aren't being able to get that testing done. What's happened is there's really an issue with the data. The system that is being used to measure the performance of health units is actually not connected with the work that the health units are doing on those cases. And essentially over the next couple of days, you'll see that data gap close, and you'll see the performance of all health units more accurately reflected. Certainly here at the Middlesex-London Health Unit, we have been diligently working to get all of the staff and residents tested in our area of long-term care facilities. We passed over the 50% mark last week when the provincial data was showing that we were at 15% tested. And so we're well on our way to meet the May 15th deadline to get all of those long-term care residents and staff tested in this area. That's it for now.
Thank you very much, Dr. Mackie. Mayor Holder, we do have some questions already lined up in the queue, so we'll get to those right away. And the first one, Mr. Mayor, is for you today, coming to us from Dan Brown at the London Free Press. For the mayor, just wondering if you saw the real estate numbers indicating home sales are down 55%. Be interested in your reaction.
Well, thanks, Dan, for the question. There were two parts to that. One was that the real estate sales are down, which I think is understandable insofar as what you have is you have a certain reluctance for people to enter homes. I also think there's some uncertainty in terms of economics right now. So I think it would stand to reason that that home sales have decreased. Having said it, we've come off a number of months of record sales. The second part that I found interesting is that the average house sale has stayed about the same. So while the number of sales have decreased, not the value. So I think in the short term, this is all likely to continue. Whether this will be the average, the new average in terms of home sales. Interestingly, I'm going to be having a meeting with the London St. Thomas Real Estate Board later today to talk about some of these very specific issues, and perhaps have more to say tomorrow if there's something that would be appropriate and able to be commented on. But right now, not surprised that sales are down. I think people are looking for certainty in these uncertain times, and we have a situation where we look forward to the economic recovery, which is being phased in, and as that happens, my sense is that sales of homes will increase accordingly.
Thank you very much, Mayor Holder. Dr. Mackie, the next question is for you. It comes from Grant Demi at MyFM in Strathroy. Dr. Mackie, yesterday you said 65% of the current reported cases in London are considered inactive and 75% for the county, with only 9 county residents who are presently having symptoms. If that's the case, how come the figures don't accurately represent the real numbers? What's the protocol to declaring a case resolved?
So the 9 active cases that I mentioned yesterday are active cases in county. In the City of London yesterday, we had 135 active cases, so 144 total yesterday. Today, that total is 152, so we've added a few active cases to our total. That's why, so the number 9 was just for folks in the county, not for those in the city. In terms of declaring cases resolved, there are 2 ways to be declared resolved. First of all is about the testing. For healthcare staff in particular, we're trying to test people to make sure that they're actually testing negative prior to returning back to work. For the general population, because of the limitation and availability of testing, we're not testing people to prove that they're negative. That's normal practice. You don't normally test folks to prove that they're negative before allowing them to return to normal activities with any disease. There would be very few examples where that would be required in infectious disease in day-to-day operations of our work. But for most people, we're looking at essentially have the symptoms resolved. So is the person no longer having a fever, shortness of breath, cough, that sort of thing? And then there's a time as well. We ask that people stay isolated for 14 days, even if their symptoms resolve. So that would be the process.
All right. Thank you very much, Dr. Mackie. The next question in line is from Sophia Rodriguez at CBC London. Dr. Mackie, you tweeted out a poll asking Londoners to vote on whether or not they'd like to see more streets open up for pedestrians. Is this something the health unit and the city are planning to do? What are some of the pros and cons of doing this? And how would we ensure that people are following social distancing guidelines on these streets?
So thanks for the question. The question about opening up additional streets for walking. The idea is that you may have more space available so that people don't have to pass each other on footpaths. There are, of course, drawbacks to this sort of approach. If you're identifying one street as a walking street, you might actually create a draw that pulls more people in, and so creates a risk there. So anything that's done that way, I think, need to be carefully monitored. Have had some preliminary discussions with staff at the city. Also, a brief discussion with the mayor yesterday about his thoughts. I'm sure he'd be happy to share them. Overall, there are definitely some logistical challenges to make sure that if any spaces are opened up, that they're appropriately opened, and that vehicles that need access for maintenance purposes or otherwise would continue to be able to access them. I would say it's an ongoing discussion, and as much as there are other communities across Canada that have done this sort of thing, I don't think there is good data available to show the net impact one way or another.
And Dr. Mackie, if I may jump in, there was a part of the question also about how would we ensure that people are following social distancing guidelines if they were to be on those streets?
Yeah. So this is one that is increasingly difficult because there are a few paths that are in high demand right now. Harris Park, for example, downtown, had a chance to be in that area on Sunday when the weather was nice, and it was very difficult for people to stick to the path and to maintain social and appropriate distancing measures. So it is really sort of a self-enforced thing. It's unlikely you would get into a situation where bylaw or public health or police are enforcing physical distancing on sidewalks. It'd be very difficult to do and to monitor, and it's such a widely dispersed problem. But it really is. I mean, we're relying on you, the media, to help us get that message out. That it is a great time to be outdoors. The weather's great. It's good for your mental health to get that exercise, get that sunshine, and also you need to take steps to cautiously protect yourself. One thing that city staff shared with me this morning when we spoke is that there are actually a huge number of sidewalks particularly in the core, but across the city, where there's actually very low foot traffic. And so it may be that you have people that are selecting those park paths rather than the available option of the sidewalks that might be less congested.
All right. Thank you very much, Dr. Mackie. Mayor Holder, would you like to?
Thanks. Yeah, thanks very much, Dan. And I certainly regard highly what the medical officer of health has said. It's in fact one of the reasons why we closed Blackfriars Bridge, which, as you know, from a vehicle standpoint, was the only entered into the downtown and never allows people to egress from downtown. But we closed that off to vehicles. That was a fairly easy close, and I think what it allowed people to do as well in that neighborhood, and also into the river area, allowed I think more access from a walking standpoint. So that was an easy decision, and Blackfriars Bridge was a decision to close, except for pedestrian and cycle traffic, was done for that reason. Others are not quite as simple. Even though one might imagine it would be, Dr. Mackie's quite correct. He made reference to things around maintenance as being one of the reasons why vehicles might still need access to a street were to be closed. There's other considerations as well. If there's businesses along those areas, how do we deal with those deliveries and pickups from retail operations that are open, or in the case where there is supply to be dealt with, even in the limited conditions that we have for business. The third consideration actually is the London Transit Commission, because that's one of the things that when we consider closing streets, there's a tremendous amount of effort that is involved in the scheduling associated with transit, and so there are a lot of partners that have to be in play to make considerations. So we've kept that as an open issue. If there are some that make sense, we would do that. but we would do that in consideration of the retail options, the city's maintenance options, and the transit options as well. So it's a number of factors that have to come into play for that. Again, which is why Blackfriars was an easy decision to make, and others we would take and consider on a case-by-case basis.
Well, thank you very much, Mr. Mayor. The next, it's not so much a question, but a statement, and this is from Steve Young at CTV London, and it's to both of you. Thank you for taking the time each day to talk about this issue. On behalf of media with CTV and CJBK, our appreciation goes out to both of you for tackling this issue head on. So thank you from Steve and the team at CTV London. Don't know.
You're welcome.
Yeah. There we go. All right, on to the next question, and thank you very much, Steve, for that comment. We appreciate it very much. Next question is for Dr. Mackie. It's from Sawyer Bogdan at AM 980 CFPL, Global News Radio. Dr. Mackie, this weekend is Mother's Day, and many are probably thinking of visiting parents, some who are elderly, and in other cases having small family gatherings to see mom. What should people keep in mind during this time? Do you have any advice for families to stay connected?
Well, the first thing that I would say is that we are still in the middle of a pandemic, and it's not yet time to have family gatherings. To that, I would add that we know that some people are going to do it anyways. And if you are, please do everything you can to keep your mother, to keep your children, to keep everyone as safe as possible. Keep your distance. Please avoid sharing food or gifts. If you are going, and again, our advice is not to have family gatherings at this point, but if you do, please do keep your distance as much as possible. Use hand sanitizer or wash your hands as you're coming and going, and frequently during any visits. And again, I can't emphasize enough, now is not the time.
All right,
I'd love to add to that too, if I can, Dan.
Sure.
I think Dr. Mackie has said it exceptionally well, and I'll reinforce the point that we've made time and again. Londoners over this last several weeks have made a tremendous investment in each other and in this community by self-distancing, by ensuring that we have groups of no more than 5 people, that we limit ourselves to our immediate family in the home, and when they walk and go outside, that they do so in a way that has respect for the broader public, and for the most part, people have been really, really good. I mentioned in yesterday's press conference we had only one charge from the bylaw enforcement with respect to someone who was egregiously breaking the rules, but yet we still had 132 warnings, and we shouldn't need to do warnings. But I think that's a testament to how the bylaw folks have tried to interpret this and encourage proper behavior. But everyone has invested so much effort to do this the right way. And we know it's hard. But look, we also know that Easter was hard, and Orthodox Easter was hard, and Ramadan has been hard. And the celebrations with the Jewish community, from Passover to Yom HaShoah. I mean, everyone has really stood tall through this. And the way that we get through this most quickly is by people continuing to adhere to the rules that weren't there except to protect each other. And the worst outcome could be to visit a family member, especially a senior family member. And as a result of that, even though we're asymptomatic, we don't know what our kids have touched. We don't know what we're bringing into their homes. So please, the best gift you can give mom and dad is to stay home and wish them as well as you can, but do it remotely.
All right, thank you very much. Dr. Mackie, we're back to you with the next question. This is a follow-up from Sawyer Bogdan, and I think you spoke to this before, but I think Sawyer may not have been on the call. So, Dr. Mackie, how many tests is the Middlesex-London Health Unit doing right now? Premier Ford said some health units are not doing enough testing. Do you think that applies to the MLHU?
Yeah, so the issue is actually more of a data issue. The health units are very actively pursuing the testing in long-term care homes, which is what the Premier was speaking to. The problem is when the problem is the data system that is being used to track this data doesn't connect well with the work, and so there are fixes in place. and kind of workarounds that are being put in place across the system to make sure that that data can be accurately and appropriately captured. But it will take a couple of days for the data gaps to be filled. Essentially, it's you've got a database that is often somewhat out of date, that's being pulled by a provincial agency, which only has access to even further out of date data, and the field that was being used, that is being asked of us to use in the database, is not one that health units usually use. So all of those are combining to paint a picture at the provincial level that doesn't look very good and actually does not well reflect what's happening on the ground. We at Middlesex-London are charging ahead. We have tested, as of last week, over 50% of the long-term care homes in the area in terms of both staff and residents. And at the time when we had tested 50%, the provincial system was showing that we had tested 15%. So, you know, the data systems are still catching up to the work right now, and hopefully that will be resolved in the coming days.
All right, thank you, Dr. Mackie. We have another question from Sawyer Bogdan, and it's a question she's had that's come up from listening to today's briefing. Dr. Mackie, when do you think restrictions at London Health Sciences Centre might be relaxed in order to allow for more visitors or more elective surgeries to be performed?
So the opening up of hospitals right now is focusing on work like surgeries that have been canceled or postponed. That'll be the first place you start to see hospitals opening up and doing additional work. Visitors, I wouldn't think are in the first level of changes of hospital policies or provincial policies about hospitals. Obviously, visitors make a huge difference when someone is sick, both in terms of helping to care for them, keeping their spirits up, and also helping to advocate for them within the system. Unfortunately, we're just not at the place at this point where the hospitals are able to open up to that level of contact with the public. They are now very much focused on, you know, which are the first surgeries that should be performed, and how to organize that work in as safe a way as possible.
All right, thank you very much. Dr. Mackie, we have a question that's come in from Jennifer Beeman at the London Free Press this afternoon, and it's actually not related to COVID-19. Does the health unit have a response to the report made by Middlesex County to the Information and Privacy Commissioner regarding discarded laptops at 50 King Street?
For sure, Jennifer, and thanks for joining the call. I think it's the first time we've had you on here, so that's great. So we've discussed this publicly a number of times. The county informed us of the issues that they identified on the 17th of April. We immediately asked that any electronics be returned to us or that we have access to them. And to this date, that hasn't happened yet. The Information and Privacy Commissioner yesterday made a statement that they felt that the breach has been contained as well as possible by the health unit and by the county. We are looking forward to the next steps where we can really put this behind all of us. The most important thing from the public's perspective is that there was never any data released publicly, no information at all, and that everyone's information has been kept safe by both parties.
All right. Well, the well of questions has run dry, gentlemen. Dr. Mackie, Mayor Holder, thank you very much again for your time today, and we look forward to seeing you tomorrow at Wednesday's virtual media briefing. We'll be here at 2 o'clock and hope you'll join us. Have a great rest of the day.
Thanks, folks.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
From behind the scenes, working cameras, audio, graphics, to in front of the camera as an on-air host or community producer, volunteers are the lifeblood of Rogers TV. Without them, the programming we put on each and every week just wouldn't be possible.